Coming up today, a baby born on the side of the road. Today we meet the parents and learn about the harsh realities of maternity deserts, plus what's being done to solve it. Good morning, I'm Alexis Del Cid. Welcome to the Morning Medical Update. It is a hard truth for so many expecting mothers. Where you live matters. Take a look at this map. You see all that red? That means it's a maternity desert. The March of Dimes says 35% of all counties in the U.S. are considered maternity deserts, which means they have limited maternity services or even no service at all. And if you or someone you love is pregnant and living in a maternity desert, it means a long drive to the hospital. And by the way, yellow and orange aren't good news by any means. Those areas also have limited maternity care as well. A Kansas mom living in a maternity desert recently shared her dramatic story with KCTV5.
You can learn a lot about a community from its local paper. On March 6th, 2024, the headline for the Miami County Republic read, "I just delivered my baby." The sheriff posted about the roadside birth on Facebook too.
I just delivered my baby.
And from there, the story just grew.
Everyone's like, yeah, congratulations, congratulations, but it was a scary situation.
We were terrified.
It's hard to understand what it was like in a car alone in the dark until you listen to the 911 call.
So we are northbound on 169 highway. Sir?
Labor began at 3 in the morning.
We have to go like now.
I have no idea what you said, sir. I'm sorry. Okay, that's all right.
Danielle and Riley raced to Olathe Medical Center more than 30 miles away.
We can get there. We can get there.
They passed a smaller community hospital with no birthing unit.
So we're in a dead spot where I don't know what to do.
Danielle realizes she'll give birth in the car.
Get the baby now. Catch him. Catch him. We're sending help over there. Stay on the line. I'll tell you exactly what to do next. I got him. The baby, okay, is the baby out? Hi, baby.
This emergency is just beginning. It will be more than 11 minutes before medical responders arrive.
It's not breathing. Okay, he's having a hard time breathing. Listen to me. Gently wipe the baby's mouth and nose and then vigorously dry the baby with a clean, dry towel for at least 30 seconds.
A family on the side of the road with no towel, no blanket, no suction, and a baby struggling.
He's struggling to breathe. His lips are purple. All right, I'm going to give you instructions on how to give mouth-to-mouth. Completely cover the baby's mouth and nose with your mouth, then blow 5 puffs of air into the lungs, about a half second each, just enough to make the chest rise with each breath. Go ahead and do that now.
If you're impressed with how clear and calm the directions are,
okay, do it again, yep.
That's because this emergency birth scenario has played out 3 times in 1 month for this dispatch unit.
Just enough to make the chest rise. Okay, did you feel the air going in and out? Yeah. Okay, he's crying now.
She sounds so scared.
Dr. Emily Matheson is Danielle's doctor. Instead of delivering Frankie, she met him in the hospital.
Just to have someone tell you what to do over the phone, like, that's horrifying.
How dangerous is something like this when you're delivering on the side of the road and you have no supplies and this was not the plan?
Yeah. I worry about, a baby could get stuck, and sometimes will require maneuvers to be able to get delivered. Sometimes moms will bleed heavily after delivery, and that can require medications and other interventions.
Dr. Matheson has patients who live 90 minutes away. They live in maternity deserts. And even if there's a community hospital, there's no birthing unit.
We just knew he was blue.
Danielle is a nurse, but her specialty isn't labor and delivery.
But then he was gurgling because he had all that amniotic fluid. His face was smashed.
In the dark, Frankie's coloring was concerning. Turns out Frankie was bruised. That's because the delivery was so fast.
it's just emotional because, you know, we're crying for help, hoping someone shows up to make sure everything's going to be okay. Sorry.
There was no blanket and no towel when Frankie was born. His dad wrapped him in a Chiefs sweatshirt.
Oh, goodness.
Riley wore it the day we met Frankie. And then Frankie and his family took it on the newborn photo shoot. Back to the highway where he was born. Quite a story down the road. Quite a lesson for now about moms in maternity deserts.
Eventually he's gonna have to wear the sweatshirt.
Yeah.
We are so thrilled to have Danielle and Riley Redenbaugh and little Frankie with us on the show today. Frankie's looking good in his suspenders.
Like the lights.
Look at what a good baby. Well, one-year-old just turned one. Riley, you're the softie in the family.
Yes.
I can tell you're grabbing tissues. What made the tears start flowing in that video?
Just thinking back of how scary it was when, before the ambulance got there, just going through her yelling and screaming, and then the whole birth, him coming out purple, not knowing, it was terrifying. But, you know, after the fact, he was fine, so it's happy, but just going back to how scary it was.
Yeah. What'd you do with the Chiefs sweatshirt?
Still wear it.
Good.
My mom dry cleaned it, got it all nice and ready for it, so I'm saying I was able to wear it again. So yeah, it still gets worn, and he likes it too.
We are also joined this morning by Dr. Emily Matheson. Thank you for being here. And Dr. Tara Chetiar. Both are OBGYNs here at the University of Kansas Health System. We really appreciate you joining the discussion. And joining us virtually this morning, we have Jody Schmidt. Jody is the Executive Director of the CARE Collaborative. That's a fantastic program connecting our health system with rural community providers to help serve patients living in rural areas. So thank you to everyone for taking the time to join us this morning. And Frankie's got a good set of lungs.
Yeah.
You like that. Danielle, I want to start with you. You were sharing before the start of this program that you had some real anxiety post-birth.
Yeah, so after he was born and stuff, and the whole thing about like him not being able to breathe, or so we thought, that I think I had some underlying anxiety anyway, and so that triggered me to have really bad anxiety, and I didn't have it with my other two. So I would go check on him every 5 minutes, whenever after he went to sleep, and I thought like he had all these different things wrong with him, and I would just like get really like angry and snappy like at my other kids and at Riley and stuff, and I was like, something's wrong. So eventually I was able to go and get on some medication, and it has helped so much.
I'm so glad that you want to talk about this, because so many people, maybe they just don't know enough about it to be able to name it, let alone say it out loud, because you're surrounded by other parents who might be having the time of their lives with a newborn, right? You're nodding your head yes. You specialize in treating this.
Absolutely.
Yeah.
So we know that mental health disorders are the most common complication to have in a baby. Up to 1 in 5 patients will have some sort of depression, anxiety, or mood disorder after pregnancy or even during pregnancy.
Wow.
When we see something traumatic like that, it makes total sense because your brain is trying to help, right? You have something happen, and our brains are designed to keep us running away from bears, and like this was the bear. And so of course your brain learns that. We see the anxiety especially in our like professional patients, because anxiety has served you well your whole life, because it makes you a good nurse to double check things, and it made you study harder for tests, and it's why you pass boards. And instead it does not help in this situation, and that is so emotionally hard for our patients to like have all of these feelings that in the past have served them, and now instead are causing all this pain and strife.
See, I had heard of postpartum depression, but postpartum anxiety, I was like, okay, well, I mean, they go quite next to each other, so it makes sense. And I said it was definitely amped up after the birth with her. Just every 5 minutes, is he breathing? Is he okay? I'm like, yeah, he's sleeping.
Wow.
He's doing all right.
Dr. Dr. Matheson, were you
Sorry,
gonna add
I was just
something?
gonna say, like, with the anxiety, like you said, it helps with like your professional career, and that's why I never got it treated, because I function very highly with my anxiety and stuff like that, and I just learned to like live with it and stuff until this happened, and then it went overboard, and I was like, I can't function anymore,
And you probably did you even name it as anxiety in your profession, or was it just you were being an awesome nurse going on adrenaline?
I think I had some like underlying anxiety. Like I have this huge thing about being late. I cannot be late at all. It gives me anxiety. I could be like 30 minutes early, and on the way here, I'm like so anxious that I'm going to be late.
Right.
And so I knew I had some, but I never really was like, it was fine.
Dr. Matheson, are maternity deserts a growing concern for you as an OBGYN?
Absolutely, especially in Olathe. We're one of the southernmost hospitals in the metro area, and we see all of these other hospitals that are close to Olathe are taking away their obstetric services. So, like Danielle had to drive by a hospital that didn't have obstetric services. So that is, scary for people.
So you're the first stop when they finally make it out of the maternity desert. Dr. Chedier, you're also seeing a growing number of patients coming to you from maternity deserts.
Absolutely, and I used to practice out in Johnson County, and that was always an issue because we'd had Anderson County right behind us, and there's nothing there. I had lots of patients that would say, I don't know what to do if this happens. I'm scared of this happening. And I grew up in Nebraska. All my family's in western Nebraska, and that was something that I was very familiar with. Was if you were at Grandpa's funeral and you had pregnant people there, they were glad I was at the funeral. Kind of thing. So yeah, it's a big issue, and it's scary.
I want to show this map that we showed everyone earlier in the program. It's a map of the U.S. When we put this up, look at Kansas and Missouri. Let's take a look at that map again. What you're going to see when that map is pulled up is that there is a bright red line down the center of the United States, and it was really jarring to look at the first time we saw it. Missouri, more than 41% of counties are considered maternity deserts. More than 41%. Kansas, that number's all the way up to 45. What are the specific things, Dr. Matheson, that you tell your patients if they're coming to you from a maternity desert?
In general, I trust moms. I think that, roadside deliveries aren't that common, and they're horrifying when they happen, but I trust moms to know themselves, and I think most of the time things end up being okay. But I also try to offer people accommodations for inducing in a way that I think can help people plan and be safe. It's just hard when you don't have control over labor. We don't have control over everything.
Do you advise your patients to carry, Dr. Chedier, a bag of like a kit in case they have to give birth in their car? Because that's something that sounds very jarring.
It had honestly never occurred to me to do that before we kind of heard this story, but I think that's a really great idea if you're that far out, to just kind of be prepared with maybe some clean towels, things that you could just kind of wrap the baby up in. When we think about risks, and Dr. Matheson talked about them earlier, but some of them is that babies can be cold when they're born too. So luckily we had a nice warm Chiefs sweatshirt, but that's, yep, you had to put a hoodie on to start your day. I'd
also recommend some sort of suction just to kind of help clear airways, because we had nothing and we had no idea what to do for him at that point. So
what a helpless feeling.
Yeah, so luckily I said I always had my hoodie on, so throw him in it, at least keep him warm. And then we went with dealing with the purple face and the breathing situation.
Oh my gosh.
So even just those little bowl sections that you get to get the boogies out of the nose, those can absolutely be used to section out a baby's nose and mouth. Yeah.
With the risk so high, this must happen so often to have the dispatcher. That's what was so striking, is the dispatcher is so calm. He knows exactly how to talk someone through a birth, and then we hear it already happened 3 times that month, but you heard something different.
Same night there was an at-home birth, and that's why the ambulances took so long to get to us. One was by us, we passed it on the way as well, the ambulance station, and then the other one was out doing a home birth, an unplanned home birth.
Oh my gosh, I want to bring Jody Schmidt into the conversation. Jody, the bigger picture on this is, why are so many community providers struggling and closing down their maternity units.
There are really several challenges that rural facilities have to deal with when it comes to maternity services. The first is that many are in rural communities that are aging, so you have a limited number of births each year, which can make it difficult for the nursing staff and the team to maintain their skill sets when they aren't using them with much frequency. So there's a quality concern. There's also the issue of limited physician availability. Some communities may have only one physician with support of nurse practitioners and PAs, and that means that physician is on 24/7, 365, which you can't do for long periods of time.
No.
And then finally, there are the financial challenges. And the reality is it is expensive to maintain OB services. You have the staffing, you have anesthesia should there need to be a C-section, you have all the equipment, the malpractice coverage, which is significantly more expensive if your facility is delivering. And the truth is more than 80% of Kansas hospitals are running in the red today. So that puts them in very difficult situations where they have to make choices about how to keep their doors open, how to keep their emergency rooms open, and whether or not they can sustain OB services.
When we talk about the Care Collaborative, how would you explain to a viewer watching who's never heard of the Care Collaborative how it works?
Goal with the Care Collaborative is to take the research-driven, evidence-based care recommendations that we use here at the Academic Medical Center and share them with communities all across the state. And we started with time-critical diagnosis, heart attack, stroke, sepsis, and we added chronic conditions like heart failure and diabetes. And now we've launched 3 programs specifically to address this issue of OB deserts. The first is an OB simulation program where we'll be taking a mannequin called Sophie out into the rural emergency room in those communities that gave up OB 10 or 12 years ago, but do still have patients, a growing number of patients, come through their doors in the very situation that we just saw this morning. And so we will be helping them practice all of those skill sets. Our Dr. Winnicke and our maternal and fetal medicine physicians have developed 6 modules that we will be training that team on so they are prepared. And we'll be including EMS. So in those circumstances where EMS has a delivery in the truck or they're helping with an unplanned home delivery, they have the skill sets they need.
This is an issue that is, go on.
Please, go ahead.
I was going to say, to your point, this is an issue that has gotten so much national attention. Dr. Chedier just returned from an OBGYN conference in Washington, D.C., where this was addressed.
Absolutely. I was at a meeting with the American College of Obstetricians and Gynecologists with about 800 of my colleagues, and there is actually a bill out there right now that is called the Rural Obstetrics Readiness Act. There's a version in the House and in the Senate that we are really hoping that we'll get some support from, because basically it would take Jody's Care Collaborative and give it federal support. It is almost the exact same thing as what we're doing in Kansas, but this would be a federally funded program that we could bring around the country.
And it is a widespread problem across the United States, as you saw from that map. This topic, did you want to add something?
No, I didn't realize how vast that map was. I knew it being around us, and I figured some weeks in the Midwest. I didn't realize all across the board how bad it was.
Yeah, absolutely.
And take a look at that again. I mean, yellow and orange are not good news either.
So we're at a big red line right down the middle. And our goal would be that you don't feel like you have to drive past the hospital that doesn't have maternity care services.
Right.
Our goal would be like, hey, I would love to have gotten to Dr. Matheson, but I know that they have been trained on how to handle an emergency. And what we see is like about 7% of family medicine doctors still say they deliver babies, which is down from about 45% a couple decades ago.
Wow.
And so we're not, living in the same world that my parents and my grandparents grew up in, where your family doc out in Anderson County just delivered your babies, then was their pediatrician, then helped you through the rest of your life. And we really need to make sure that those folks in those areas are able to deal with this, so that you guys don't have to drive past this.
Such a good point, because my friend Sarah grew up in a very rural area in Kansas, and her dad was the town doctor.
Yes.
He did everything, delivered babies, treated strep throat. I mean, her phone would ring in the middle of the night, and she'd answer it, and it was also their house was the doctor's office. If you have a question or a comment you'd like to share, just use the chat on YouTube or Facebook. We'll read your comments and questions in real time, or you can email the Medical News Network. All that information is right there on your screen. Not lost in any of this is, Danielle, you're a nurse.
Yeah.
You run on high adrenaline. You're so used to caring for people in emergencies. What's it like when you're the one having the emergency?
I think it's really difficult because I work on the PCU. I do mostly like strokes and stuff like that. And you see those people like at the worst of their life, and they're like depending on you. And you are the one that has to be calm, and you have to help them through this situation and stuff like that. And it was very scary whenever there was my husband, but there was nobody in the 911 operator, but nobody helped me through the situation or calm me down. And I wasn't a nurse at that time because I'm sitting there, I'm having this emergency. I can't even think clearly enough to be able to do it. All I can see is flashes of everything I learned in nursing school of what could go wrong instead of how to fix the situation at hand. And I was more worried about his breathing and all that kind of stuff. But it was just hard because we were doing rescue breaths and stuff like that, not knowing that he was just purple because it was still the middle of the night.
Oh my gosh.
And bruised and stuff.
Well, the purple would have been terrifying.
Yeah.
That was
And we
hard.
got into the hospital, because she went to the ambulance, and by the time I got up there, I get to the floor, and I could hear him screaming. So I come in, and his face is purple, and then the first thing the nurse said was, "It's okay. His O2 stat is 100, and he's screaming." And I said, okay, so we're good. It's just something else. And she's like, it's bruising. And I'm like, oh, that makes sense. I just, in the time of it, was not thinking. I just saw purple head baby, can't breathe, and you go to worst case scenario.
We have a graph that Dr. Chetiar shared with us that I want to show our viewers because it's from the American Medical Association. This compares the rising cost of medical care to the payments that Medicare gives to physicians. So what do these two lines tell us?
So what you can see on this graph is that costs are going up for everything, right? We've been talking about the cost of eggs. The costs are going up for everything. And unfortunately, what we pay doctors has not gone up. And it's easy to say, it's going into our pockets, but it's not. That's how doctors pay to keep the lights on, right? That's how we pay our nurses. That's how we pay for lab fees, all of those kind of things. And as we kind of talked about earlier, obstetrics is expensive. It's also legally challenging, right? We know that OBs get sued, and that means the hospital's with them. So as we see these costs not even going up with inflation, but actually going down, there was just a recent cut of 2.9%, more and more doctors are can't afford to do this.
Closing the door.
And they're closing the door. And that's what we're seeing around the state. We're seeing hospital after hospital after hospital close, private practices close, and it's just getting worse.
That's exactly to Jody Schmidt's point. I want to go to some of our questions from our viewers because we have plenty coming in. Angie wants to know, Dr. Matheson, how common is it for a mom not to make it to the hospital? For you, for your patients.
I know. I don't know that I have a statistic off the top of my head how often it happens, but this was notable. I can think of maybe 2 patients in the last 5 years, but maybe I don't want to think about more of them.
What struck me too, watching the story that was put together by KCTV5 is it's such a rural area that you're able to do a photo shoot on the highway. And in the middle of the day, that's how sure you are that no one's coming along that road.
Yes, and that exit is for the lake, and then there's a wakeboard part. And so in the middle of February, no one's taking that exit.
My goodness.
But with him, it was just
so stressful.
Yeah, that not knowing until the ambulance showed up was the biggest thing.
We have another question coming in from Jeremy Yenser. He wants to know, are maternity deserts more of a rural area thing, or are they in metro areas as well?
They are in metro areas as well. If you look at, for example, Chicago, people have to go a long way out of some of the areas of Chicago where we have low socioeconomic status areas, and that to get into major metropolitan hospitals. Yeah.
So it's not just a thing
It
where
is
you
not
picture
just a real
someone
thing. Yeah.
living in the country. This affects everyone, which is why the map is so red.
I was gonna say my labor was only 30 minutes. Like I only have 30 minutes. Like if you're in a big city, you still have to go through those stop signs and stoplights and stuff
Rush
like that. And I was like, man, you might not make it up there either. Like I didn't realize that he was gonna be that fast.
Yeah, because the one, our kid before him, she was born and it was a 4-hour delivery. And so I figured it was going to be a little bit quicker than that, but not a half an hour.
Right.
It was like she woke up and said her water broke, and I was like, okay, so we started getting ready to go.
Some time.
And then 5 minutes later, she's like, we've got to go now. And I was like, well, how far are the contractions apart? She's like, they're not stopping. And I'm like,
Oh, gosh.
so this is a now situation. So we loaded up and yeah, Nana waited for Nana to get there for the girls, and we were out the door.
Wow. This is such an important conversation. I'd love some takeaways from the discussion. Dr. Matheson, I'll start with you. What's the one thing you want people watching to know?
I think that we all want people to be safe. We all want our patients to be safe. We want to help healthcare professionals stay trained in a way that we can keep everyone safe.
Dr. Chetiar?
I think what I would ask kind of our audience, especially since I know we have a lot of healthcare providers watching this, is to keep advocating, because this is something that it's not what we train to do as doctors, as nurses. We thought we were just going to have to learn medicine, but it turns out that really we need to be out there talking about these things, because that's how we get action. So keep advocating for your patients, keep talking about these things, because graphs are graphs, but these are real patient stories, and this is our stories to tell, like as patients, as providers.
And Danielle, as the person who gave birth in a car a year ago, your baby's happy, healthy. What's your message?
I think
He's behaved so well. It's okay to let it out. It's okay.
so basically, like, I want people to know, and the reason why, like, I choose like who I speak through the media with is because this isn't like, this was a happy story, but it could not be a happy story, and it was very scary. And I want other moms to know, like, more about this kind of stuff, because like I was terrified, and I don't want others moms to be as scared as I was and stuff like that, because like, yes, it all was good. It was all happy and all that kind of stuff in the end, but a lot of things could have went really wrong.
Right.
And I am so thankful, like, not gonna lie, God was right there through everything, all the professionals that came out to help and stuff like that, because everything went perfectly. And
goodness.
I don't think that will always happen to maybe other people.
And that
so,
911 operator
yes,
was so calm and so stellar.
very helpful, just because like
Yes.
I wasn't thinking clearly, because with all the pain and everything that I was going
could
through,
you?
like
No.
I couldn't think clearly. So it was nice to have someone be able to be soothingly talking to me and being like, here's what you need to do. So
When we could hear him.
over the screams.
Yeah.
Riley, what about you? What do you want dads watching and other families to know?
Well, not just dads, but the mental side of it. I didn't know how big of an impact it could be. So the mental, like I said, the postpartum depression, but with her, the anxiety of how real it is, and with mental health, I mean, it can take a serious toll. And so that's just one of the biggest things from it, is take care of mom too.
It's so special, because we do need partners to speak out, husbands and people in the family who see this happening, because we need advocates for that. When you're in the moment, you're not thinking clearly and naming it. Well, can we get just one close shot of Frankie, because Frankie is so cute. Oh, that's okay. Oh boy. Did I just jinx us? And Jody, as we take a look at Frankie here, what would be your final message to our viewers?
final message would be that those who live and work in rural communities deserve the same high-quality care that folks receive at our place at the University of Kansas Health System and in other urban areas around the state. And so we do need new federal programs. We need to do some regional planning so we can figure out how maybe can we stand up some OB services in communities that together we could sustain them where they might not be able to individually. So I really do believe that there are collaborative efforts necessary to help us address this growing crisis.
Jody, thank you so much for all the important work that you're doing as well to shed a light on this and work to solve this. Thank you again to our guests for taking the time to join us. Dr. Chetty or Dr. Matheson, thank you. We know you're busy. And thanks to our viewers. We will see you right back here tomorrow morning.
Coming up tomorrow on the Morning Medical Update, a remarkable procedure uses the power of sound to burn a tiny part of the brain, curing tremor in the process. For Rita, it was the answer to a lifetime of uncontrollable shaking. I'm Jessica Lovell on the next Morning Medical Update, brain surgery without a scalpel. See the one-day procedure offering patients instant results, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.